All right. Sorry about that, guys. We had a little our camera kind of chopped off around 21 minutes and 46 seconds today. So to get back to it, Charlie, are you doing all right still?
Doing good.
Okay. Back to it. We were discussing as to you had mentioned how you're feeling with your anxiety lately and your PTSD flashbacks. You had mentioned that your PTSD flashbacks have been relatively okay. If you do get any moments like that, they're only happening in school, and they're not nowhere near how that flashback was whenever you went to the hospital as of late. And we also discussed that your anxiety is still there, still present, also has seemingly been getting a little bit better, but it's still there in the same spaces that they were before in school. Mm-hmm. Is that right? Okay. Now I wanted to talk about, since we are leaning more into your diagnosis, we went into what the DSM-5 says about anxiety or disorders and PTSD, and that kind of gives me more of, it's a really good tool that we use as counselors that gives us a really good synopsis of what we're using to diagnose patients with after all like the evidence that has been collected throughout the years and years of psychology and disorders. And I wanted you to kind of like tell me like whether you feel that you can relate to the things that I'm saying as far as anxiety disorders and PTSD. So starting with anxiety disorders, we have the main triggers usually occurring with or without an identifiable trigger. Sometimes you could just, whether it be something that someone says in the hallways at school, they could also just be, throughout the day, just like small moments of just feeling anxious, like no matter what, like whether it be something that happened environmentally or just something that's going on in your mind, that anxiety, it happens throughout the day at school, Now, core symptoms could be excessive worry, panic attacks, which we talked about. That's where like those three senses grounding techniques can come in when you have those panic attacks that are usually associated with anxiety and your PTSD flashbacks. Physical tension. I remember we discussed, I think in our third session, that you'll usually like feel tense, like have like trouble breathing a little bit. Mm-hmm. Would you say that's still a thing whenever you are having these anxious moments? Physically, how are you feeling when they're happening to you at school lately?
Since lately they haven't been as bad as like the actual PTSD ones.
Right.
Yeah, like whenever it's kind of more just like the anxious moments, it's definitely like chest feeling kind of tight.
Mm-hmm. Okay.
And like maybe a little like disoriented.
Okay.
Yeah.
Okay, so almost like whenever you did have like that really big one, not nearly as bad as that where you were like totally blacked out,
right?
But like, you feel like you kind of like detach a little bit from like where you are in the world around you a little bit.
Yeah, like my head kind of feels like lightheaded a little bit.
A little hazy. Okay.
I just always thought that was from like the breathing, like maybe me not getting enough oxygen or something. Like I thought my head was just lightheaded.
Yeah, no, most definitely. Most people who do get hospitalized for panic attacks and stuff, they'll like when you stop breathing, like you can get like tingly, like if you're not getting enough oxygen to your brain itself during these panic attacks, you could pass out, which is probably exactly what happened to you whenever you were having that panic attack. Now, timeline typically present for with anxiety disorders and diagnosing them is going to be less than or greater than greater than or equal to 6 months. So, and I definitely say these have been present for quite some time throughout your life. Starting around the abuse, you started experiencing some anxiety and flashbacks, and which happened before high school, and throughout your childhood. It's been going on for some time. so as for PTSD, trauma and stress are related, with your stressors that happen around school, or your stressors that are just happening in your head or at home when you see your mom upset, when you're struggling to connect with your dad. Sometimes you could just be put in this state of these, this pressure in your mind, anxiety, and built up into these PTSD moments and issues that are all culminated from these situations and stressors. So main triggers usually require exposure to actual or threatened trauma, which you've quite had a lot of, throughout your life. And core symptoms consisting of, for PTSD, is flashbacks, avoidance, hyperreactivity, and usually in these moments, you'll like feel that reaction, you'll feel that thing coming on, and you'll like close up, like you say, like you kind of close off, and instead of like screaming or yelling or anything of the sort, when those things happen to you at school, you kind of just like, shut down a bit. And symptoms must last greater than or equal to 1 month, which this has been going on since the abuse like we had garnered. That's kind of briefly what the DSM-5 talks about. As for the triggers, of course, symptoms, and the timeline regarding anxiety disorders and PTSD, it's really, considering that these are things that do impact your day-to-day life, in really important, aspects, considering school and stuff. I'm really happy that you're here and seeing me, because this is definitely something that we could work on so that we can make you have a really good quality of life. And not to say that it isn't, but we could definitely make it to where your school life, your studying, the way that you see and view yourself and the world around you is something that we can try to work through. And I wanted to, next session, we're going to actually like dig a lot deeper into utilizing CBT. We touched base on what it is briefly last session. I just wanted to get a better synopsis of assessing you regarding your diagnosis this session, and making sure that the progression was still there, and from our sessions, and that we've been garnering like a really good thing with your journaling and creating some good behaviors that can help you feel happier and more, and help